Cefdinir is a generic name for the trade name drug Omnicef. Okay, so as with all these other cephalosporins that we've talked about, this has the same prefix, the CEF. CEF are cephalosporins, okay? Therapeutic class is anti-infective. Pharmacologic class is cephalosporin second generation, okay? The reason we're going to give Cefdinir is for treatment of skin infection and otitis media. Its action, again, is bactericidal, meaning that it binds to the bacterial cell wall, and this causes the cell to actually die. Okay, so we need to understand that all these cephalosporins work kind of the same way, but they work on different types of bacteria and different types of infections. So the Cefdinir works best with skin infections and otitis media. So it's something that you may give your kids at some point. If they develop an ear infection, they'll go to the doctor. The doctor might give them Cefdinir, or Omnicef is what it's known as. Okay, so a lot of our nursing considerations are going to be the same for a lot of our other antibiotics and for our other cephalosporins. So the biggest thing to keep in mind here is we want to assess our patient for cephalosporin allergy as well as penicillin allergy. Again, a lot of our patients that have allergy to penicillins may have allergies to cephalosporins as well, so we want to monitor for that. Can lead to seizures, pseudomembranous colitis, C. diff, diarrhea, phlebitis at the IV site, and anaphylaxis. So we're going to want to be monitoring our skin for any sort of phlebitis at the IV site, and we're going to want to be monitoring for any sort of anaphylactic reaction, skin reaction, or any sort of anaphylaxis with our patient swelling, things like that. Assess for infection and allergies. Again, obtain our cultures prior to therapy. If we have that ability, we wanted to monitor and draw blood cultures to see what exactly we're fighting against so we can give the best medication possible for that. We want to monitor bowel function, monitor for bleeding, and monitor our CBC and looking for what our WBCs are so that we can see, are we treating this infection? Is it improving? Monitor our temperature. All those things that would indicate infection. We want to be monitoring those things to see, is our patient improving, okay? So those are kind of the things we want to keep in mind with all of our cephalosporins, but today specifically we're talking about Cefdinir, also known as Omnicef. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.